Community health workers and the Vermont Area Health Education Center holding a first-of-its-kind statewide conference.
NBC5's Sid Boulay joins us now from the studio. She has more on how the new industry is shaping up. Sid?
Alice, Stu, earlier this year, the Southern Vermont Area Health Education Center received a $520,000 grant to help build community health worker professions. Today, they took the next steps to organizing the industry here in our state. You might have heard the term community health worker before, but what exactly does that mean?
Really, it is a massive umbrella term, but what is at the center of it is community health workers share lived experience and trust and compassion with the communities that they serve.
For example, these healthcare workers could be bilingual or an immigrant, identify as LGBTQ, or come from rural communities.
You're coming from a new country, especially if you are a refugee, it is incredibly difficult to adjust to a new culture, a new community, and brand new health systems. And so what better way to help yourself do that than by having somebody who understands your community and the challenges you face.
Managing medical care can be stressful. These health workers say they want patients to be able to have providers that they can identify with.
In rural areas, individuals are often culturally more reluctant to go for help.
Katina Cummings says these health workers help to bring care to those in their community, which can mean treating an illness before it's too late.
They are instrumental in bringing in people into those systems so they can get the support like anyone else can get.
But the industry's first ever Vermont conference also focusing on becoming organized across the state.
We don't have a professional standards for training yet. We don't have professional recognition yet. And so it's the first time that these organizations are meeting together to discuss how community health workers can advance.
We want to advocate for community health workers to be protected, to be sustained, and to be respected. And we really want community health workers to be recognized as the subject matter experts and leaders that they are.
The conference included multiple speakers from the healthcare industry and networking opportunities, all to begin standardizing the field. Going forward, the Vermont Area Health Education Center wants to see the profession recognized on a policy level and to develop as a workforce. Live in the studio, Sid Boulay, NBC5 News.